Hello, listeners. A warm welcome to Views on Health. A great pleasure to have with me on the program tonight Dr. Dinushka Jayaweerabandara, consultant physician attached to the emergency department at the teaching hospital in Karapitiya. Thank you, doctor, for coming into Colombo.
It's a pleasure.
From down South Gaul
Yes.
to be with us on the program tonight. A great pleasure to have you with us. And
Thank you.
for the information of our listeners, Dr. Dinushka Jayaweerabandara is going to focus on diabetic foot. As a matter of fact, we have discussed diabetic foot a few years ago, and we thought it would be important to refocus on this health issue, considering the fact that, for one, Dr. Jayaweerabandara considers it important because he's treating these patients on a regular basis, and we too, as lay people, do hear of those who are diabetic and whose medical issues, have basically been there for a long time. It's a prolonged illness, and it has at some point begun to affect one's foot. Having said that, by way of an introduction, over to you, Doctor, while welcoming once again to SLBC and our studios to give us a brief overview on what exactly is diabetic foot.
Thank you very much. Diabetic foot, to begin with, is considered the Cinderella of diabetes care because very little attention is given to diabetic foot, unlike to the kidneys, the eyes, the heart, and the brain, where lots of attention is given and care is given, but very little is focused on the diabetic foot. So let me begin by giving you the WHO definition of the diabetic foot. It says that the foot of a diabetic person that has the potential risk of pathological consequences, including infection, ulceration, destruction of deep tissues associated with neurological abnormalities, peripheral vascular disease, and metabolic complications of diabetes in the lower limb. So, making it more simple, it's any foot pathology that results directly from diabetes or its long-term complications. So let me give you a few facts and figures as of to why diabetic foot is very important. To begin with, there's a 15-fold higher risk of people with diabetes having major amputations. And there's a 15% of all people with diabetes will develop diabetic foot ulcerations. And there's a 5 to 15% will require lower extremity amputation at some point of their lives. Also, the incidence of major amputation is noted to be about 0.5 to 5 per thousand patients with diabetes in Sri Lanka. And also about 4.3% of admissions were due to diabetic foot ulcers back in 2009. And the average hospital stay is considered about 11 days, which is quite significant. And the diabetic foot ulcers occupied about 10% of the hospital beds, which is quite a large number. And also about 60% of the diabetic foot ulcers starts following a minor trauma, which can be prevented and also easily be treated before it gets worse and becomes complicated. So another important and significant point I would like to mention is that every 20 seconds, someone in this world is losing a leg due to diabetes and diabetic foot. Many of us are involved in the care of the diabetic foot. I must mention the physicians, the surgeons, vascular surgeons, and even orthopedic surgeons. Talking a little bit about the mechanism of diabetic foot or the pathophysiology in the scientific term. So there is something called peripheral vascular disease, which involves narrowing and changes in the major blood vessels supplied to the leg, which can be worsened by conditions like high cholesterol as well as smoking. And also there is a condition called neuropathy. With time and poor diabetic control, the nerves get burnt out and the patients experience a condition called neuropathy. They may have numbness, tingling sensation, and even burning sensation of their feet, which gradually worsens. And also there is mechanical stress involved, especially with inappropriate footwear, and also foot deformities are noted to happen, and chemical or thermal injuries may contribute to diabetic foot, and last but not least, infection, which is the most important component, which can fast track a simple wound into a major diabetic ulcer, and also result in an amputation.
Doctor, thank you so much for that detailed introduction. And whilst I know you and I don't want to strike a discordant note, but it is a picture of gloom as far as diabetics are concerned, the patients who do the diabetes. So if every 20 seconds worldwide, if somebody is losing a limb, and here you're having like 10% of the hospital beds being occupied by such patients, it certainly doesn't augur well for Sri Lanka. So obviously, doctor, in your day-to-day practice, you're coming across a lot of patients with this condition, which is why you want to focus on this very important health issue that we are grappling with. And more so, doctor, now again, you represent the government health sector, so where treatment by and large is free. And it's a huge, I would say, toll on the coffers. And currently, while we're grappling with an economic situation as well, it must be that much difficult to give the patients the best in terms of medication. So having put all this together, where do we go from here? What is the first step that our listening public has to take note of to prevent this happening for themselves, assuming they're diabetics?
Yes. So a very good question. So the patient can do a lot for themselves in order to prevent the diabetic foot. So to begin with, they should wear appropriate footwear, meaning it should be appropriately fitting, not too loose and not too tight. And also, each time they wear their footwear, they should check the inside of their footwear for little grains of sand or small pieces of stone, and that will prevent any unwanted injuries happening while they're wearing their footwear. That is very important. And also, wearing footwear at all times is also an important public health message I would like to convey. I tell my patients, you are only permitted to remove your footwear when you're going for a shower or when you're going to bed. So some people might argue saying, what about religious places? So what I say is, you can wear some thick socks in order to prevent trauma happening to the feet, especially when there is additional neuropathy experienced by the patient. But they can remove their shoes for a short period of time, but they must make sure that they wear thick socks so that they don't cause any trauma to their feet. Another important thing they can do is to examine their feet daily. So after a busy day, they can wash their feet with lukewarm water, some soap, and dry it with a clean towel, and then have a look. Specifically look for any redness, change of color, bluish discoloration, any wounds, or swelling, or any tender point. If you're having problems with your vision, you can get your loved ones to have a look at your feet, or even you can use a mirror to see the soles if you're finding it difficult to bend your knees with conditions, especially like osteoarthritis. So that's something very important I would like to highlight, because if you note any signs of the above mentioned changes, you should consult your family doctor, period. Another important thing I would like to mention is about cutting nails. So I would like to encourage patients with diabetes to cut their nails horizontally rather than cutting it deep inwards, to prevent any of the nails remaining pricking their skin, which can result in infection. And also they can get someone else's help if they are finding it difficult to cut their own nails. And also, using a moisturizer can prevent unnecessary drying of skin, and which can result in itching, and also and result in infection setting in. So a moisturizer at least once a day is encouraged, even if you're having dry feet or not. But make sure that you don't use the moisturizer in between your toe webs. That is to prevent any unwanted retention of moisture, which can lead to a fungal infection. So try to avoid the web spaces between the toes and any other place you're permitted to apply the moisturizer. So that's something important I would like to mention as well. And also we should avoid walking in the hot sun, especially without any protective footwear. So that is also another important message, because patients often have lack of sensation in their feet, and they will just walk, and then maybe the next day or two, couple of days later, notice that there is a bad burn and an infection sitting in, which can result in an amputation ultimately. So these are little things I would like to highlight, where the patient themselves can screen their feet for any warning signs or symptoms.
Thank you, doctor. Now, obviously, when a patient comes to you, you do give good advice. You say, please do this, please don't do that. And hopefully, they are receptive to what you say. Having said that, now a person who is diabetic, so that's the first thing. A person has got diabetes,
High blood sugar.
High blood sugar.
Yep.
As a result, now that is being treated. So at which point does this condition set in? I mean, is it because they have neglected taking their medication or taking care of themselves? Or is it because the situation is within the system deteriorating, leading to this condition? It's good to know. Of course, it varies from patient to patient. There's no sort of general rule across the board.
Correct.
But about which point do you think a person will be facing this situation?
So we actually are supposed to screen the patient for any evidence of having a diabetic foot at the point of diagnosis. It is so important because often patients are asymptomatic or do not come to a medical person or a doctor, and they do not know that they are having diabetes. So as I mentioned earlier, a few mechanisms are involved in the formation of diabetic foot. Initially, there may be peripheral vascular disease. As I told you, there is problems with the supply of blood to the tissues in the foot due to advanced what we call in medical terms atherosclerosis, that is deposition of so-called cholesterol within the inner walls of the blood vessels. And also with poor control, poor diabetic control, the nerves can get burnt out, which can result in neuropathy. Again, leading into diabetic foot, because they do not have the joint persistent sensations, they do not have the feeling that their feet are being burnt, or in case of a potential injury, they do not feel it, and they might walk with some foreign body in their feet or in their foot. So that is something important as well. And as I told, inappropriately fitting footwear can result in mechanical stress on the feet and can result in ulcers and a diabetic foot. And also foot deformities. So with wasting of muscles, which is seen in advanced diabetes, the arches may get deformed. There are various deformities. I can mention things like hammer toe, clawing toe. There's something called Charcot's feet. So these deformities can happen with time. So as a result, it can result in diabetic footwear.
Doctor, just a question. When you screen them at the very outset, the patient comes to you, and what sort of tests are done in the screening process?
Yes, a very good question. So, well, if a patient came to me, I would like to inspect their feet. I would take a minute of my time with the patient and explain that looking after your feet is equal to looking after your eyes, for example. So I would like to have a look at their feet, and I would look for any ulcers, any deformities, any redness, shiny skin, loss of body hair, for example, and those little things. Then I would like to feel their pulses in the lower limb. And if the blood flow is quite good, the pulses felt in the lower limb would be normal. And also The other thing is we can use a small instrument called the monofilament test. It's like a small, I might say, a string-like thing attached, and we can press with that and feel whether the patient has the sensations. So a standard amount of pressure is applied on the feet, and if the patient can feel the sensation, that is considered normal. And if the patient is unable to feel the sensation, that test is considered quite significant, and that means there is early onset of diabetic foot and special neuropathy. And also, if there's any infection, we should treat it aggressively and early with antibiotics ideally, and antiseptics as well. And there's something called advising the patient to wear appropriate footwear. And if there's any evidence of an ulcer, we may have to even refer the patient to the surgeon as well.
This test that you conduct to check the sensation, could there be something in between? Not the lack of sensation or the fact that it's normal, could be somewhere where, yes, I feel it a bit, but I don't feel it that much. Is that possible? And
yes,
if so, what would you look at it as?
It is possible, but it is quite subjective. So most of the time, our patients would say, I do not feel it. So what we do is we ask them to say maybe yes, or ask them to count from 1, 2, 3 like that, as and when we press. Using the monofilament. So then if the patient is unable to respond, then we know that there's something wrong, and then it can be repeated as well.
Because you need to be sure that,
exactly.
Because sometimes patients may not be that clear in what they say to give you the correct picture.
It's important to explain what you're going to do, and also you can increase the sensitivity of the test by asking the patient to close their eyes, so that they will not try to cheat on you, in other words.
Okay, thank you, doctor. That's interesting. So you have this situation, and then you have done your diagnosis, and so the initial screening, which is very interesting. I didn't know that it was to happen at that point in time. The very first visit, you check to ascertain whether the patient is coming in for this condition.
Correct.
So that based on that, you do your treatment.
Well, yes, and if everything is normal, at least once a year we would advise the patient to get their feet checked by a medical practitioner. So that is very important. Just like we are having our eyes being screened annually, our kidneys being screened at least annually, just like that, we would advise the patient to get their feet examined by a qualified medical practitioner, just to see whether there's any evidence of early onset of diabetic foot.
Isn't 1 year too long a time, considering that they may get something in their feet because they're moving about?
In between, we advise the patients, as I told you earlier, to look for any signs or symptoms of diabetic foot or injury. Okay. Daily foot inspection is very important, as I mentioned earlier. So they should look for any signs of redness or discoloration, swelling, or any tender points. And if there are any of those present, they should see a medical practitioner as soon as possible.
Thanks, doctor. Now, going on from there again, we have this situation. So, as you said, worst case scenario, it could be the removal of a part of the limb.
Yes.
Obviously, lots of things will be done in between to preempt that.
Exactly.
But it can happen anyway. So, as far as we know, once diabetes sets in one system, there's no reversal. It's there for life. So, as a result, such a patient has to take care of himself or herself to ensure that that is controlled and it won't lead to other things.
Very true.
To various sort of worst case, situations where their health is concerned.
Correct.
So, from which point would you really have to? You did say about having these tests as well, sensation tests and all that, to ascertain. But end of the day, the patient needs to cooperate.
Yes, very true. So patient compliance is of paramount importance. That's why we should take additional time to understand our patient and to see the level of education, and also most importantly see the level of understanding of what we have mentioned. So if we feel that the patient is not understanding what we have mentioned, we should take an additional couple of minutes and explain again and make sure that they understand. So what I do is I make my patients repeat what I have told them so that I know that it's gone into their system. And also I must mention that it's a holistic approach trying to manage diabetic foot and also trying to prevent it. So we must encourage the patient to control their blood sugars. They should control their cholesterol levels, and also most important thing I must mention is if they are smoking, they should stop smoking completely, because all these processes are accelerated if the patient is smoking. So they must stop smoking immediately.
Intake of alcohol?
Well, alcohol has little, I might say, effect on diabetic foot, but it has indirect effects such as the blood sugar levels may be poorly controlled if the patient is consuming alcohol regularly. The patient may also have falls and injuries if they consume excess alcohol, and also the level of consciousness may be altered in case of intoxicity, and they can cause that can lead to unnecessary injuries and lead to infection and diabetic foot, worsening of diabetic foot.
So the picture of gloom of an amputation, it has happened, right? I mean, it's happening. Is it every 20 seconds across the world? How bad is Sri Lanka?
Well, I think we are not too far behind, I might say. The condition is, I think, equally bad. So we must educate our public and our patients in person as well. The importance of controlling the diabetes itself, and also looking out for the complications of diabetes, especially diabetic foot, because a breadwinner can easily lose his livelihood. The family will be having lots of financial issues if that happens, and also worst case scenario, the patient even may lose his or her life because of the complications of the diabetic foot, because wound healing is impaired in diabetes, so further infection is possible, and the patient may go into what we call sepsis and can even lose their life.
So doctor, what does it lead to from diabetic foot? What other organs can get affected easily?
So as we know, the diabetes is well known to affect basically any organ in the body, any organ or system. So the common things that we know are the eyes, which can result in cataract, a condition called diabetic retinopathy. Then also it can affect the kidneys, which can result in chronic kidney disease. It can cause neuropathy, as I mentioned earlier, which can affect the nervous system. And also it can result in what we call macrovascular disease like heart attacks. It can result in stroke. It can result in what we call peripheral vascular disease, where the patient may experience pain when walking for a specific amount of specific distance, and they may even have rest pain if the condition gets worse. So it can affect basically all organs, and also things like impotence in males, which is hardly discussed, can too happen in diabetes.
So it is not good at all. As from your feet or your foot, the problem shoots up to your body and spreads to, almost to your head.
Well, it's a head-to-toe condition.
Head-to-toe condition, yes. So
we have to focus on.
Yes, I know, doctor. So time has caught up with us. It's been very interesting listening to you. Unfortunately, we have a limited time frame within which to express your views and for me to ask some questions. What is your take-home message?
Well, one of my take-home messages would be to look after your feet just like you look after your eyes. So you can do a lot to prevent and catch this condition early. And it's very important for us as clinicians to facilitate screening of diabetic foot in our patients. And the patients themselves ask their healthcare practitioner to have a look at their feet once in a way. I think that's also a good message.
Thank you, doctor. And on that note, we end this interesting discussion on diabetic foot and place on record our grateful thanks to Dr. Dinushka Jayaweerabandara, consultant physician attached to the emergency department at the teaching hospital in Karapitiya. Thank you so much for being with us on the program. and
Thank
sharing
you.
your expert knowledge with our listeners. Thank you, Doctor.
It's been a pleasure. Thank you very much.
My thanks also go to Kalyani Egodapitia for technical assistance. I'm Fatima Razi Carter saying good night and looking forward to your company next Monday, same time on Views on Health.